Have you ever wondered whether diabetes can be reversed naturally without relying on medications? If so, you're not alone. Millions of people living with diabetes dream of finding a way to restore their health without daily pills, insulin injections, or the constant fear of complications. Today, we're going to dive deep into the science and the real-world practices behind naturally managing and in some cases dramatically improving type 2 diabetes. You'll learn about evidence-based lifestyle strategies, powerful diet changes, stress management techniques, and the truth behind all those miracle cures you see online. Before we begin, let's make something clear: there is no magical overnight fix. However, research has shown that with the right approach, many people have been able to achieve healthy blood sugar levels, reduce or even eliminate medications under medical supervision, and reclaim their quality of life. Grab a cup of tea, sit back, and let's uncover the shocking truth about healing diabetes naturally. Understanding diabetes, what are we actually trying to cure? Diabetes is a chronic condition marked by elevated blood sugar levels. There are several types. Type 1 diabetes, an autoimmune disorder where the body attacks insulin-producing cells in the pancreas. People with type 1 require insulin therapy for life. Type 2 diabetes, the most common form. The body becomes resistant to insulin or doesn't produce enough. Gestational diabetes occurs during pregnancy. When we talk about curing diabetes naturally, we are primarily referring to type 2 diabetes. Type 1 cannot be reversed naturally, though lifestyle habits can improve health outcomes. It's essential to be realistic. For type 2 diabetes, the goal is remission, meaning blood sugars return to non-diabetic ranges without medication. This doesn't mean the disease has vanished forever, but rather it's under control. The role of diet, the cornerstone of natural diabetes management. Let food be thy medicine. Hippocrates knew what he was talking about. Numerous studies confirm that what you eat can make or break your blood sugar control. Here's how diet can help. 2.1 Low-carb and ketogenic diets. Carbohydrates are the primary macronutrient that raises blood sugar. Reducing them can have a dramatic impact. A growing body of evidence shows low-carb and ketogenic diets can lower A1C levels significantly, reduce insulin resistance, promote weight loss. For example, a 2019 study published in Diabetes Therapy found that adults with type 2 diabetes who followed a ketogenic diet achieved remarkable improvements in blood glucose and even reduced or eliminated medication use. What does this look like in practice? Eliminate refined carbs like white bread, pasta, and sugary snacks. Emphasize non-starchy vegetables, healthy fats, avocado, nuts, olive oil, and moderate protein. Tip: always consult your healthcare provider before starting a very low-carb diet, especially if you take insulin or sulfonylureas. 2.2 Plant-based diets. On the flip side, research also supports plant-based approaches. Diets rich in legumes, whole grains, vegetables, fruits, nuts, and seeds can improve insulin sensitivity. A large review in Nutrients in 2019 concluded that plant-based diets could significantly lower A1C and body weight. Key principles: fill your plate with colorful vegetables. Choose whole grains like quinoa or barley. Avoid highly processed plant foods. 2.3 Intermittent fasting. Another powerful strategy is intermittent fasting, where you cycle between periods of eating and fasting. Some studies show intermittent fasting can improve insulin sensitivity, support weight loss, lower fasting glucose. For example, the 16-8 method, fasting 16 hours, eating in an 8-hour window, is popular and easier for many people to maintain. Reminder: Never attempt fasting without consulting your doctor if you're on glucose-lowering medication. Exercise, moving towards remission. Exercise is a cornerstone of natural diabetes management. Physical activity helps improve insulin sensitivity, lower blood sugar levels, promote fat loss. Types of beneficial exercise. Resistance training builds muscle mass, improving glucose uptake. Cardio, walking, swimming, cycling. Flexibility and balance, yoga and Tai Chi reduce stress and improve well-being. Aim for at least 150 minutes of moderate intensity exercise per week as recommended by the American Diabetes Association. Stress and sleep, the overlooked factors. Stress can wreak havoc on blood sugars through the hormone cortisol. Chronic stress is linked to insulin resistance. How to manage stress naturally. Meditation and mindfulness. Deep breathing exercises. Spending time in nature. Journaling. Sleep is equally important. Poor sleep increases hunger hormones and insulin resistance. Strive for 7 to 9 hours of quality sleep nightly. Supplements and herbal remedies, what the science says. You've probably seen countless ads for diabetes cures in a bottle. While many claims are exaggerated, some supplements have evidence of benefit. Berberine, shown in multiple studies to lower blood glucose similarly to metformin. Cinnamon may modestly improve fasting glucose. Alpha-lipoic acid supports insulin sensitivity and nerve health. Remember, supplements are not a replacement for lifestyle and medical care. Always discuss with your doctor. Weight loss, the power of shedding pounds. If you're overweight, even modest weight loss, 5 to 10% of your body weight, can lead to significant improvements in blood sugar control. The Diabetes Remission clinical trial DIRECT in the UK demonstrated that weight loss achieved through a structured program of diet and lifestyle resulted in nearly half of participants achieving diabetes remission after 1 year. Strategies include portion control, meal planning, consistent physical activity, support groups or coaching, debunking common myths. Let's bust a few myths. Myth: natural remedies can completely replace all medications overnight. Truth: while lifestyle change is powerful, abrupt stopping of medication without supervision can be dangerous. Myth: diabetes is always progressive. Truth: with the right approach, many people achieve remission. Myth: you have to give up all carbs forever. Truth: some people thrive on low carb. Others do well with balanced whole food carbs. Personalization is key. Creating your personalized plan. There's no one-size-fits-all path to naturally reversing diabetes. Here's how to start. Consult your healthcare provider. Discuss any major diet or lifestyle changes. Track your numbers. Monitor your blood glucose and A1C. Set realistic goals. Small, consistent steps are more sustainable. Find support. Consider working with a diabetes educator, nutritionist, or online community. Conclusion. So, can you cure diabetes naturally without medication? While the word cure is controversial, thousands of people have achieved remission, normal blood sugars without medication, through sustainable diet, exercise, weight loss, and stress management. The process isn't fast or easy, but it's absolutely possible. If you or someone you love is living with type 2 diabetes, remember, you have more power over your health than you've been told. Your daily choices can dramatically transform your life. Thank you for listening. If you found this video helpful, please like, subscribe, and share it with others who need hope and guidance. And remember, this is your journey. Take it one step at a time. Stay healthy, stay informed, and keep believing in your ability to thrive.